The Value-Based Healthcare Prize is an initiative from Value-Based Healthcare Center Europe. Value-Based Healthcare Center Europe is founded in 2008. It's a platform basically focusing on VBHC implementation. And besides having 6,000 premium members, 32,000 normal members, many people who've done certificates, there was a decision now 11 years ago, inspired by Professor Porter, to have the Value-Based Healthcare Prize. And that is the starting of it. Why this Value-Based Healthcare Prize? This Value-Based Healthcare Prize was basically to recognize those people in our community and outside of the community that are very successful in implementing value-based healthcare. Recognition for the team, recognition for their efforts. That was one bit. The other thing, of course, was to get inspired and make sure that we all learn, that we see it can be done, and get actually inspiration of the results, but also inspiration of the energy of the teams who are embarking on that effort. And of course, there's always a celebration. So the Value-Based Healthcare Prize, if you have a chance, look at the video of the event. It's a very celebratory event. We have a great jury recognizing those initiatives, and that's basically what the prize is about. So over the years, we're close to 1,000, I believe now, in terms of applications and inspiration that all kinds of teams are doing around the world. And we see that many people look at it, download it, use it for their teams to get inspired, and hopefully apply for the Value-Based Healthcare Prize the coming year. We see a lot of improvement and changes if you take the applications for the prize. From that angle, it's good to see now 10, 11 years of progress in value-based healthcare implementation. So if we go way back from, let's say, the content bit, we were really thrilled 10 years ago with a great outcome set that would create and have prompts in it and would have a learning cycle, and we would be absolutely thrilled. Now, if you look later, you see people having great institutional efforts or creating networks, not only in their countries or in their regions, but also worldwide in exchanging outcomes, in exchanging better pathways, in learning and inspiration. So we see a lot of the value-based healthcare implementation going forward. The last 3 years, you see a lot of content and applications which contain technology bit, not only data and AI, of course, but also all kinds of other medical techniques, exchanges. So we really see the medical field progressing, but it seems that value-based healthcare is a very good vehicle to implement those new technological possibilities. So that's what we see. And of course, 4 or 5 years ago, many of us were struggling with how can we get a pay for performance or a pay for outcome measure, and we saw some early ones 6 years ago, but now it has become commonplace to be very keen on that we get paid in a fair way that's at least in alignment with what we do. So we've seen a lot of progress there. And the final thing is we get better and better as a community and as a complement to everybody on scaling up within the hospital, within the network, but also outside of the network. And that trend is absolutely inspiring. And I'm always so thrilled to see the teams when they win, that recognition and that energy that they show to everybody, because it's not done on a Monday afternoon, right? This is work of a couple of years. So on the one hand, we see great progress. We see many medical conditions moving forward. It started very much, of course, with, let's say, breast cancer or cardiovascular or those areas, great areas and great progress. But we've seen, fortunately, after the years that internal medicine came in, that primary care came in, and that we see now more and more of, let's say, the rare diseases coming in, movements to more specialized care and to more elaborate prevention approaches and palliative care. So we're across the spectrum of that. And finally, what I'm very proud of, being Dutch and now sitting in Amsterdam, is basically seeing that, of course, the Dutch really tried to do this and start working with it. And unfortunately, we see many other countries coming around. So this year, I believe we have more than 25 countries that made it to the application, and actually we could really say that many countries, from Australia to Canada, from Brazil and Argentina, to Singapore or Japan are in the competition. And I think that is a wonderful to see, and in this world where we I think need to work together and get better healthcare for everybody, I see that collaboration as a real big gift of both the prize and of Value-Based Healthcare Center Europe. What are we looking for in the applicants? We look at have they done the VBHC implementation, right? So let's just say, did they really tick the boxes in terms of is there a clear stratification, a medical condition, and is that well thought through? How is it going with the outcomes? Is there medical outcomes? Are there patient-reported outcomes? Are there experience measures? And does that make a lot of sense? And is it sort of smartly done? Do they stratify? Do the technical stuff okay? What do they do with managing their cost and getting control on that? So let's say the core of the work there that we need to take. Of course, the last couple of years we see, are you deploying technology? Are you having an impact on your stakeholders? Is inclusiveness and things like that working? So let's say we take the box on what is, some would say high value care, some would say patient-centered care, we call it value-based healthcare as the original approach from Porter's Common. So we need to take that. And then the jury looks at if that works. It's never perfect. There's always work in progress. So that's one thing. The other thing is there really something interesting, something new, something exciting that has been done in the work. And thirdly, of course, what's the impact of it? What's the impact and the potential impact, and how do we think that is important in doing that? I must say it has become. We see more applications every year, so that's great. Pre-applications as well as applications. It's become harder and harder to be among the selective group of nominees. You already should be applauded by being a nominee, I think. And then to win a prize or an award is absolutely crown on the work. And that's great. Having said that, there's so many good initiatives that we get that are not yet there because it's a moving target to win the prize. And we have the Dragons Grant there, and that is every year also exciting to see what are the great new ideas, what are the great new implementations that we know 2 or 3 years from now will probably be winners. So I view it as a community. I see it as an inspiration, as learning from each other. But we look at, do you tick the boxes? Do you really have something new? Is there something really exciting? And what's the impact that you have or that you can potentially have? Having said that, of course, not everybody can win. But what we see is that people that have made it to a nomination, let's say 1 or 2 years ago, are now up for the prize. So the feedback that the jury gives and that we give, and sometimes there's some extra education, whether it's a green belt, a black belt, or something like that, or there's some technical things that could be improved, or some bits on having a more complete IPU. With that advice, we see that some people really use it to learn and improve over time their efforts and ultimately win the prize. So that is a development we didn't envision, but it's great to see that we see people coming back and learning from each other and learning from the jury. This year's winner, and actually we saw it a long time coming, is from Texas, from the University of Austin. I can show it here if you want to have a look at it. The VBHC Prize 2023. You have all the nominees in there, and the winner was this year, 2023, was the University of Texas Austin, with next generation musculoskeletal conditions of care. Why did it win? And it won because, of course, it ticked all the boxes. But even if you looked at ticking all the boxes, that were actually absolutely great. For instance, on including the segmentation and the medical condition in that field, say, wait a minute, we also need to make sure that everybody, regardless of their social standing, regardless of the way the insurance is working, is included and gets that get the great service that's needed, and may need to get more or less services given that. So even there was progress in terms of inclusiveness, in terms of making sure that specific needs for specific groups were addressed in the team. So you could see already on that thing, wait a minute, they really pushed the boundary on that. Other example is on cost, making sure that they tracked not only time-driven activity-based costing later on, but had the technology in place to see who's doing what when, and get very carefully on showing what are the costs that we do in certain fields. What is in the IPU? It's a very broad IPU in terms of not only the people that you would think would be in there, but also dietists, social workers did a great job there. So all of the 7 or 8 points that we looked at were absolutely top-notch individually, and then you see the flywheel, which makes it fascinating. And already 3,173 patients were in, so you could see there was progress. That you could show lower cost per patient cycle, could show better outcomes, could show stratifications, could show that. And what we were particularly amazed at were 2 things. Was the very careful deployment of technology, both in having a platform for the patients and looking at what they could do, having predictive models of if you do this, you're probably going to need an operation or not going to have an operation. That was amazing, but also deploying that very, very carefully and very well thought through. But the most amazing thing was basically the payment models. With all these different paying models for all these different groups, the US is very complex. I thought my country was complex in payment models, but the US is absolutely king on having a complex payment model. And we're able to do that and relate that all to outcomes, to better results, and do that for everybody, and moving that forward across the United States. And that is really a very well-deserved example. So congratulations again to the team of Texas, because this was indeed a new level that we can all aspire to. The partnership of Value-Based Healthcare Center Europe and the decision group with ICHOM, and if I may say ICHOM's partnership with Value-Based Healthcare Center Europe, I think has been exceptionally fruitful. To take a step back, when we tried to figure out in the Netherlands basically, but also in other countries of Europe, can you implement VBHC? There wasn't an ICHOM. It's hard to believe, but there wasn't an ICHOM. And we were so thrilled that ICHOM was there after we came up with some outcome packages and do that, and that ICHOM brought that forward and made sure that there would be this international set of outcome measures. So that is such a fantastic contribution, and I know we really encouraged Dutch hospitals to join, and they did. So I'm very happy with that progress. Now, what I think made that very, very strong in terms of always a collaboration is our focus on value-based healthcare implementation. How do you really get it done as a doctor, as a nurse tomorrow and on Monday, and what are the challenges that you face? And that has been, I think, a very good combination. So very many people have been members at both or involved in both organizations. So that's very, very, very good. And then to collaborate on ICHOM's yearly conference with and showing there, who is this year's winner, who are the previous year's winners, what are the great trends, is absolutely great to show to a wider audience even who's winning and how much progress we are making on implementation and what we can learn from each other. And that, I think, is the real contribution where both the ideas, the examples that it can be done across different health systems, across different medical conditions, by different levels of people, by smaller and bigger teams, and as we all know, at a certain point, the devil is in the details. And being at an ICHOM conference, or for that matter, being at the Value-Based Healthcare Prize, to just talk to each other and learn from the little tricks and the little things, how to do it and how to work our way around it, I think is the most valuable thing. Apart from that, they're just nice people to work with. so I think that is important, as always, in a very great, friendly atmosphere, and having the feeling that what Professor Porter put down and saying, there is a way forward in moving to sustainable healthcare systems, to strong patient-centric care, with a strong focus, of course, on the economics, but an even stronger focus on patients and on people delivering. And that I think is great to see. We have allies in doing that, and more people are working on it. So I could talk a long time about it, but the collaboration has been great. It's very, very great in terms of the outcome sets and in terms of the network. It's a real honor and a pleasure to always introduce the prize winner of the year and see what the details are. but the most important thing is to meet people and discuss what are the things that we can do easier, better, smarter in implementation. And that's why I'm looking forward to Barcelona again this year. I'm sure we're going to meet a lot of friends there. Submissions for the 2024 prize are opening at the 1st of September. So we are ready to look at your applications, 1st of September. The process is you only need to send us 100 words, 1 page. We're going to have a look at whether you have a chance this year to be a winner. We'll give you some feedback. If you are, you get more information of moving forward in the process. So 1st of September. Then please follow the VBHCprize.com website, where you will find all the information, both of the pre-application and the ultimate formal application in doing that. And alongside that, many of you do that already. Follow the LinkedIn pages of VBHC Center Europe and some other things that we have out there in terms of VBHC Center Europe, because we're going to give you updated information and progress on that. So that is for 2024. We are ready to look at your application, to support it, and to give you feedback on it. And absolutely excited to see how far you're going to get. But certainly you're going to learn, we're going to learn, and there's going to be a lot of attention to it. So that would be great. Then finally I have something special. We're looking forward to the Barcelona ICHOM event, and I'm sure it's going to be great. But after the ICHOM event, we have 2 days of the VBHC Greenbelt Intensive. And it's highly recommended when you're there or for your team to do it. We're going to talk about VBHC implementation. We have more than 112 cases that we're going to share and discuss with you. There's going to be network, there's going to be examples, and you can do an exam. But going to Barcelona, doing ICHOM, getting all this knowledge, and also making sure you're certified on the Greenbelt level for you and or for your team, that I think is an amazing good idea. So hope to see you in Barcelona, and wish you a great summer.